Hello and welcome to our presentation about an intervention which aimed to educate and inform our patients. This took place at Broomfield Hospital in Chelmsford, Essex, part of the Mid and South Essex NHS Trust. I'm Lucy Westcott, the current perioperative fellow here, and my colleague Danielle Fawkes is the lead author and she's the past perioperative fellow. This is an excellent role that can be undertaken in or out of training with the chance to gain great experience. We were supervised by Dr. Niven Akotia, one of our consultants, and Dr. Al Hughes, who's the lead for Periop across the Mid and South NHS Trust. So the background to this is there's evidence that preoperative educational interventions can lead to improved patient experiences and positive post-operative outcomes. In our Anaesthetic Assessment Unit waiting room, there was an underused widescreen television, and it was decided to make some use of this to disseminate patient information and education. Pre-assessment staff were surveyed for their opinions on what content should be included in a presentation, and a 20-minute video was constructed which covered lifestyle advice, nutrition, smoking cessation, exercise and alcohol reduction, information about our anaesthetic assessment unit locally and what to expect, wellbeing support, and the RCOA Fitter Better Sooner video which was used with permission, and information about our current research projects. And to ascertain if this was in fact a useful intervention and helpful for our patients, we conducted a survey over 1 week in April of this year, handing out questionnaires at the end of their pre-assessment appointments. So looking at the results, we had 46 questionnaires returned, and of those patients, 57% had watched the presentation. The main reasons for not watching were predominantly due to issues with practicalities of seating arrangements and not being able to see the television. This figure summarises the views of those that watched, and as you can see, it was very positively received. The free text comments were also very interesting and included things like, nice to know that anxiety is quite okay, I think this should be a compulsory watch, good general information, I've taken a lot of the advice on board, it was scary, I was okay until I watched it. So in summary, we feel that this is a low maintenance, effective intervention, and we would recommend it to other departments. We've already made changes to the seating arrangements such that it can be watched from all seats, and we plan to embed the presentation in our patient-facing website such that it can be viewed pre- and post-appointment, and hopefully this will allay anxiety. I'd just like to finish by saying thank you for listening and give our thanks to all the pre-assessment staff at Broomfield Hospital.